What if there were a simple blood test that could detect cancer years before you feel a single symptom? Before a tumor shows up on any imaging, or before traditional screening ever catches it? You'd want to know about it, right? Well, those tests exist today, but there's a lot of confusion around them. So in this video, I'm going to break down clearly how they work, and most importantly, who should actually consider getting one. I'm Dr. Kabir Harricharan Singh, and my approach to medicine is simple. I don't like to wait for disease to show up. I try to look for the earliest signals so that we can act before things progress. And right now, early cancer detection is one of the most important conversations that's happening in modern medicine. Quick disclaimer, I am a physician, but I'm not your physician. Everything here is educational information only, not personal medical advice. Always talk to your doctor before making any healthcare decision. Let's start with something foundational. Traditional cancer screening genuinely saves lives. There's no debate there. Mammograms reduce breast cancer mortality, colonoscopies cut down colon cancer death, pap smears have dramatically reduced cervical cancer death, and low-dose CT scans reduce lung cancer mortality in high-risk smokers. These are powerful, proven tools, but here's the catch. They only screen for a handful of cancer types, and they only catch something once a structural change has already formed, meaning you need a visible mass, a polyp, or something the imaging or scope can actually see. So what about the other 70% of cancers, the ones that don't have any recommended screening tests? That's the gap liquid biopsy testing is trying to close. Here's how it works, and I want to keep this simple. When cancer cells develop, they shed tiny fragments of their DNA into your bloodstream. This is called circulating tumor DNA, or ctDNA. Cancer DNA carries abnormal methylation patterns, which are essentially chemical tags that act like a molecular fingerprint, marking which genes are turned on or off in a way healthy cells simply don't. These tests scan millions of those DNA fragments, looking for patterns that don't belong. And here's why that matters. Those molecular changes can appear before a tumor is large enough to be seen on any scan. They're looking for the molecular smoke before the fire is even visible. But, and I want to be very clear about this, these tests detect the signal. They do not diagnose cancer. A positive result always requires follow-up imaging, and further evaluation to confirm what's actually happening is needed. Now let's talk about CancerGuard, made by Exact Sciences, the same company behind Cologuard, which many of you may already be familiar with. CancerGuard takes kind of like a different technical approach. It uses what's called a multi-analyte strategy, meaning it doesn't just look at one type of signal. It analyzes both circulating tumor DNA and tumor-associated protein biomarkers simultaneously. The logic here is that cancer doesn't leave just one fingerprint, and by combining two different signal types, you can cast a wider net. CancerGuard was officially launched in September of 2025, and here's where the data stands. They have a sensitivity of 68% across the 6 deadliest cancers, including pancreatic, ovarian, liver, esophageal, lung, and stomach cancer, but an overall sensitivity of 64% across a broader group of cancer types. And they have a 97.4% specificity. In CancerGuard's landmark Detect A trial, they showed meaningful detection of cancers that currently have no screening options at all. One practical advantage worth noting is that CancerGuard is available through Quest Diagnostics with an at-home and an in-office blood draw option. It can be ordered annually for adults aged 50 to 84 with no active cancer diagnosis, and CancerGuard is not FDA approved. It's also a laboratory-developed test. So, what is the current limitation? CancerGuard is newer to the market, and the long-term outcome data is still maturing. CancerGuard's multi-signal approach, it's scientifically sound, and early data is genuinely promising, especially for earlier stage cancer detection. Again, it's important to remember that neither test replaces your standard screenings. They layer on top of them. So, who's a good candidate for these tests? Great question. You may want to consider these tests if you're 50 or older and proactive about your health, if you have a strong family history of cancer, if you want a wider net beyond the cancer screenings we currently have, if you understand clearly that a positive result is a signal to investigate, not a diagnosis, and you're prepared to follow that through. On the other hand, you may not be a good candidate if you're unwilling or unable to pursue follow-up testing after a positive result. If severe health anxiety would make an uncertain result more harmful than helpful, or, and I really want to emphasize this, if you're thinking about using these tests instead of your regular screenings, these tests work alongside standard of care, not in place of them. The hardest part of preventive medicine isn't ordering the test, it's knowing what to do with the results. A positive signal without a structured follow-up plan creates chaos, not clarity. Context, interpretation, and who guides you through it, they actually matter. If any of this resonates with you, bring it up with your doctor at your next visit and ask them if these tests make sense for your situation. The goal isn't to create anxiety, it's to use the tools available to us to catch things early, when the options are still good. Okay, I'll see you in the next video.